New at 4:30, there's a new president at Rochester General Hospital, and here's what he's hoping patients will say.
Look back on it and say, I didn't want to be in that office, I didn't want to be in a hospital or have a procedure, but that's about as good as it possibly could have gone.
News 10 NBC investigative reporter Jennifer Lewke sat down with Dr. Randy Green today to talk about his plan for thinning out an always packed emergency room, his vision for improving patient care, and what the future might look like for all of us with the use of more medical AI.
Dr. Green has already taken the helm here at RGH. He's leading a team of thousands of healthcare workers tasked with taking care of all of us, anyone and everyone who walks through those doors.
I met with Dr. Randy Green just after he wrapped up a heart surgery here at RGH. Patient care in the morning, hospital presidential duties in the afternoon.
We've seen our healthcare system sort of stretch to the max over the last several years. That had to weigh on you when you decided whether to take this job.
Every part of our system, as you said, every specialty is stretched. Part of taking the role was the opportunity to deal with that. Hi guys.
One of the first things on his agenda, he says, is recruitment and retention. He has some plans for programs that will offer upward mobility to those who commit to RGH. He's hoping to continue to cut down on contracted nurses.
We are using far less than we have in the last 2 or 3 years. I think we're down to almost an appropriate level of using traveler nurses.
There's also no doubt that in order to keep up with the crushing demands on our healthcare system, they're going to have to step outside the more traditional ways they've been caring for people.
I think there's opportunities to expand the use of technology to make the care more efficient. Telehealth, teleradiology. We have opportunities to use advanced imaging to more quickly diagnose patients.
And speaking of those patients,
what are your sort of goals and vision for improving the patient experience? Because most of us are probably only ever going to be a patient here.
Yeah. I think it starts with feeling safe and secure in the environment. It starts with friendly faces walking down the hall. Once you get into an office, it has to be a very connected experience with the provider, and that starts with the front desk and the person rooming the patient and the nurse, and eventually, a great deal of competence on the part of the provider.
In addition to his medical credentials, Dr. Green also has a law degree. Before coming here to Rochester, he was the head of cardiac surgery at SUNY Upstate in Syracuse. In Rochester, Jennifer Lewke, News 10 NBC.
There's been a lot of talk about security at RGH following an incident a few weeks back where a man got inside the hospital and upstairs with a gun. Jen spoke with Dr. Green about that and the steps being taken to address the safety of staff and patients. She'll have that story coming up new at 6.